couldn't believe it, nearly 28,000 people from 126 countries signed the petition, and it gave us a really great platform to be able to approach people like the World Health Organization and tell them why encephalitis matters. We decided to do this petition because we began to realise that some things weren't quite adding up. Generally, it's known that there's about 500,000 cases a year of encephalitis, but that doesn't make sense when we began to look at the incidence figures of the different causes. We've also, at the Society, become slightly more anxious over some of the vaccine hesitancy, and we're beginning to see encephalitis in what were once thought eradicated childhood diseases. Then we also began to realise that encephalitis has a higher incidence in many countries than motor neurone disease, multiple sclerosis, bacterial meningitis. And then finally we realised that actually it has a worse disability outcome than Parkinson's, motor neurone disease, MS and central nervous system, so brain and spine cancers.
It's really important that the World Health Organization listens to what we have to say about encephalitis. They of course recognise some forms of encephalitis like Japanese encephalitis and rabies, but encephalitis is so much more than that. We know there are all sorts of issues with surveillance, with diagnosis, with improving patient management and thinking about outcomes, and indeed with prevention. And we want to work closely with the WHO to effect change in all of these areas.
We're here today to ask them specifically to help us improve the dialogue, the conversation about encephalitis on a more global platform.
I think for change to happen, we really need health professionals to work together along with patients and the public, governments and of course the World Health Organization. And I think if everybody pulls together and prioritises encephalitis, then we will achieve some real change here.
Encephalitis matters.